My name is Soufiane El Halani. I'm a PGY3 resident in anatomical pathology residency program at the University of Ottawa. So my topic of healthcare advocacy is understanding health advocacy through actions. The problem in the rest of the part of the world is that less than 5% of the women get a pap smear in one lifetime. So we thought this is not acceptable, and with the contribution of different physicians, scientists, and me personally, we came up to develop a system, a small portable automate that will be able to detect the cervical cancer cells in a pap smear automatically. So this is very helpful when you know that in the rest of the world there is a lack of human resources and sometimes financial resources to implement a national program based on pap smear. So what we do in our program is that we identify countries with proven political will in developing a sustainable cervical cancer program. Then we support the local pathologists for leadership and healthcare advocacy role. And then we demonstrate that this technology can be taught and learned with very minimal training. And finally, we do a demonstration project. We approach a national control agency and we compare the performance of our automate with the local screening tool that they have in order to improve their screening strategy. So one of the best places that we look for is Morocco in North Africa. It is an interesting country with an interesting profile because they have 34 million inhabitants and they have occasional pap smear being done in the urban cities. However, there is no pap smear being done in the rural area, in the isolated villages. Morocco has a leadership of the Queen, so she created a foundation called Foundation Lalla Salma in order to bring strategies for cancer screening and treatments. And we found that this is very interesting because we have a very strong leadership from the Queen's Foundation that will be very helpful for us to implement our strategy of health advocacy through the foundation. So once we identify the country, we identify as well a local pathologist who is going to be our future champion of healthcare advocacy. And we then support him with all logistics support. So we can, for instance, ship a system, one of our automate being produced in China, we ship it from China to Morocco. Then for technical assistance, how to set up the system, we ask people from Slovenia and Eastern Europe to bring their assistance and help in order to set up the system in this lab in Morocco. Then we ask for people coming from Canada who are volunteering to train these people in Morocco how to use the automate and how to prepare the slide for pap smear, how to stain them and process them into the automate. Then we have help from United States of America in the person of Ernie Knessel, for instance, who is helping us to provide kits for how to prepare the slides and for the pap smear. So it was an international collaboration from different continents, converging all their effort to Morocco to implement this strategy of healthcare advocacy through the automation of cervical cancer.